And as we said in the beginning, there are certain factors in our lifestyle, in our environment that cause inflammation. So obviously, getting rid of inflammation would be to try and look at what's causing it. What are there chronic infections? You can test those things. You can do gut microbiome testing. You can measure the nutrient levels that are needed for methylation, for all these different things, and then optimize them. But then you can also do things like you were talking about, having bad sleep or jet lag or stress, how that can contribute to inflammation. For example, short-term stress can lower inflammation, but chronic stress has been shown to make the body not respond to that anymore and make us more inflamed. So a big, huge one is stress. And they found that if we manage to and learn to switch over to the parasympathetic nervous system, that the relaxing, restorative mode, instead of constantly being in that fight or flight mode, that can lower inflammation. And that's all research based. So that's a really easy thing people can do. Just some belly breathing, some saunas, some whatever they'd like to do, meditation, journaling, reading a book. If they're lucky enough to be in a beautiful environment like Switzerland, go hiking in the mountains, looking at greenery, or the beautiful Lake Geneva. All of that has been shown to stimulate the vagus nerve and the parasympathetic nervous system, that has been shown to quench inflammation. And also sleep, people that are jet lagged. Research shows that just one night of lack of good quality sleep makes the body slightly more inflamed the next day. I found that so mind-blowing when I read that. So people often, they try to do all the right things, but then they're busy, they're CEOs, they're just busy individuals. And then they skimp on sleep because they think that's not that important. But actually, those are the basic cornerstones that are so crucial and that we can influence day to day, just really focusing on sleep, on stress, getting the right nutrients, getting rid of chronic infections, making sure that we're not being polluted with heavy metals all the time, not eating tuna every day because it's full of mercury, for example. So we can obviously measure these things. So I do that a lot with the functional medicine, gut microbiome testing, heavy metal testing, nutrient levels. So you can actually see where things are missing, where things are too much, and then you can very specifically optimize it. So you get to the root cause of inflammation. And then back to the blood sugar thing that I mentioned in the beginning. Again, I find that a very interesting topic because I see this so often in my patient population, in particular also people that are trying to be healthy. They're still having all these blood sugar spikes from healthy foods. And I find this a really wonderful tool, is just wearing a blood sugar monitor for 2 weeks. And it's available everywhere. It's very cheap over here. It's £50. It's not a lot. You can wear this monitor for 2 weeks and you can see on your phone what your blood sugar is doing and how it responds to different foods and drinks. Sometimes even stressors. If you are having too much coffee or you're over exercising or you haven't had enough sleep, then your blood sugar control will be different afterwards. So it's fascinating. And then the important part, and you're obviously aware of that, but I just want our listeners to know this, is that when you do all these tests, you want to make sure you optimize it, because the normal blood ranges, the normal blood sugar ranges as well. Therefore, they're basically, you were talking about the red light and the green light before, but there's also often that yellow light, right? Where people are not in the red zone. People are often, when they look at the blood sugar, they will only flag it if it's in the red zone, if there is a risk for diabetes. But there's this whole big range in between being already having a full-blown disease and the optimal range. So they found that blood sugar should be very narrow, actually. And any time that blood sugar comes out of that optimal range, so still far away from the danger zone, but every time that comes out, it causes microinflammation. If that happens a couple of times a week for an hour, not a big deal because the body can heal itself. But if this happens all day long, and I see this all the time, people that overexercise, stress, constantly snack healthy foods, a little bit of fruit here and there, start the day with porridge, constantly these mini spikes in the normal range contribute to microinflammation. And then we can do all these wonderful tools, we can add wonderful supplements, but if we don't address the root at what we do day to day, I always find that we want to do it hand in hand. We want to make sure that what we do day to day works well for our mechanism and our organism, and then we can add all these wonderful extra specific tools to it. You have to do it all at once. Just get started, baby steps, slowly build on that, and you don't have to do things perfectly. Just slowly little things add to it, and eventually it accumulates to be a massive snowball that really helps you feel better for longer. That's our goal, right? Quenching that inflammation so that we live longer. You touched upon health span right in the beginning, not just living longer, but living better quality. That's the whole point of our work and what I do over here with my private clinic. We're looking to optimize health span, longevity, not just living longer, but putting life and quality of life into those years.